Our open data platform that we're creating is about enabling all the data that we currently have to be turned into information, and therefore allowing people to have insight into what we're doing, how we're delivering it, and start to make some real business intelligence decisions about how we deliver research, how we can facilitate better research to be delivered, and how we can make it quicker. The idea being that we have this transparent data set that everybody can have access to. We stop the discussions about whose data is correct, because all the data is in one place. Everybody puts whatever data they need into the same place, and we provide the tools to allow any data to be manipulated. Everybody's reading from the same page at the beginning. I think the future for open data in research in particular is becoming larger. You've got the concept of big data, which is the trendy IT term at the moment. I think one of the things we see though in clinical research is whether big data is actually just more hay on the haystack of data. What we're hoping the open data platform will do is actually give us that metal detector to find the needle that's in the big data haystack. And I think that's the excitement, is what we've put in place should allow us to actually start to access that data, make those data linkages, and really start to push that forward as a way of facilitating better research. I guess the plan for the future is we've got the pilot just completing now for the open data platform. We've done some evaluation of all the information managers across the networks. They've been using that pilot version, which is just the portfolio data. The next stages are to start to put more data into there. So we're looking at the CSP data, the permissions data going in there, the industry data going in there, and then start to look at the external data sources we can link that to. What we need to do is engage as many parts of the different elements of the networks as soon as possible in what data they think they need to do that. So there'll be a series of workshops through the summer as we start to work out what other data can be in there. Things like cancer registries have been talked about already, and how we can actually link that data into there and make that work and fit together.